leave it open for so you guys can see. Hand sanitize. Hello, my name is Maisha. I'll be your
Hello.
nurse today. What brings you in today?
Physical exam.
Can you tell me your name?
Anthony?
Do you know where you are?
Yes. Chamberlain Lab.
Do you know what year it is?
2014.
2014. He is alert and oriented times 3. He was dressed appropriately for the weather. He is well groomed, well nourished. He has a pleasant affect. He was able to get on the examination table without any problems. Do you have any pain?
No.
If you did have pain, I would assess it on a scale of 0 to 10. 0 being no pain, 10 being the worst pain ever, and ask about any aggravating or alleviating factors or use OCART. So now moving on to skin. I'm inspecting his skin. He has some pink undertones, some macules, nevi noted, one birthmark on the right shoulder. Skin is warm, it's dry, texture is smooth. He has good elastic recoil when assessing skin turner. Inspecting his nails. They're pink, they're shiny, they're smooth. Capillary refill, less than 2 seconds. Inspecting his head is normal cephalic. Now I'm going to palpate his head. There's no masses or lumps. Inspecting hair. Hair is brown, evenly distributed. Dividing the hair into 3 places. There's no excessive dandruff or infestations. Moving on to the face. Eyebrows are symmetrical. Palpebral fissures are symmetrical. Could you smile? Nasolabial folds are symmetrical. And since I'm in the face, I'm going to go ahead and do eyes. Eyelashes curl. The top ones curl up and outward. The bottom ones curl downward. Irises are brown. Cornea smooth and glossy. Free from any lesions. Sclera is white. Conjunctiva is pink. No drainage. Then can you just look at my nose? Good. And then can you follow this pen only with your eyes? Wonderful. Pupils are equal, they're round, they react to light. There is accommodation and a consensual reaction. I'm going to have you follow this pen only with your eyes, don't move your head. You ready? He has smooth and coordinated eye movements, no strabismus or nystagmus. Cranial nerves 3, 4, and 6 are intact. Nose is midline, no redness swelling. Noted. No crevices. Breathe in. Breathe in. Bilateral narrows are patent. Put your hand back. Move inside your nose. No deviated septum. Turbinates are pink. There is some clear drainage. Moving on to the ears. Ears are symmetrical. He does have some macula and nevis on the ears. No redness, swelling, or drainage. Look at the external auditory meatus. No redness, swelling, or drainage. Palpate the pinna. Pull on the lobe. Pull on the tragus. Any pain?
Nope.
Moving on to the other ear. Skin color is consistent with the rest of the body. There's no lesions in this ear. No drainage. Looking into the external auditory meatus. No redness, swelling, or drainage. Palpate the pinna. Pull on the lobe. Push on the tragus. Any pain?
No.
Moving on to the neck or face. I'm going to palpate. Sorry. Oh, those are just your shoes. I'm going to palpate your sinuses. Frontal, maxillary. Any pain? Can you open your mouth? Moving from side to side. No crevices noted. Cranial nerve 5 is intact. Preauricular, postauricular, occipital, submandibular, submental, tonsillar, superficial cervical chain, deep cervical chain, posterior cervical, supraclavicular, no palpable lymph nodes. Okay. Carotid arteries are 2+, regular rate and rhythm bilateral. Look up to the ceiling. Bring your head or chin to your chest. There we go. Can you look out that window? Look at the wall. Bring your right ear to your shoulder without lifting your shoulders. Do the same thing to the opposite side. Shrug your shoulders. I'm going to do those same movements against resistance. Can you bring your face towards my hand? So let me push it away. Good. Ear to your shoulder. Let me push it away. Same thing on the other side. Don't let me push it away. Good. Shrug your shoulders. Push them up. And don't let me push them down. Cranial nerve 11 is intact. You have full range of motion. Strength was a +5. Now moving to mouth. Lips are pink, free of lesions, moist. Could you smile? Okay. Smile a little more. Good. Gums approximate teeth. Can you open? No caries. Buccal mucosa is pink and moist. Soft and hard palate is intact with no lesions. Stick out your tongue. Dorsal part of the tongue has papillae and is pink because you lift up the tongue. Ventral side is smooth with veins. Frenulum is intact. Can you stick out your tongue again? And now moving from left to right. Cranial nerve 12 is intact. Can you stick out your tongue again? Say ah. Wonderful. There's no redness to the pharynx. Tonsils are +1 with no exudate. Uvula rosal phonation. Could you swallow? Wonderful. Cranial nerves 9 and 10 are intact. Could you swing your legs that way for me? So now I'm going to do the thoracic cage. So we're going to do posterior thoracic cage. If you need to see, you got to move over. So I am thoracic cage is symmetrical. Skin color is consistent with the rest of the body. There are some papules, nevi, and macules. No signs and symptoms of labored breathing. I'm going to check your thoracic expansion. Can you take a deep breath? And out. Wonderful. He has symmetrical thoracic expansion. Every time I touch you, I want you to say 99.
99, 99, 99, 99, 99, 99.
Awesome. Even vibration felt in all lung fields. And I'm going to percuss. Resonance heard within all lung fields. All right, now it's time for auscultation. Take a deep breath. And out. Again. 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 Okay, you can take some normal breaths. And when auscultating, say in between the scapula and the spine. Making sure you do, that you listen for one full inhalation and exhalation before you move over. I'll move down. Comparing one lung to the other. Deep breath. Deep breath. Okay, you do normal breaths. Vesicular breath sounds. Now we can move on to cardiac. I'm going to have you lay down for this. We have to come closer again. There we go. Alright. So I am inspecting the precordium. Skin color again consistent with the rest of the body. There is some macules. No heaves or lifts. Now I'm going to palpate the chest wall. No thrills are palpable. Apical pulse is palpable. I'm going to auscultate. Okay. Aortic. Pulmonic. Herb's point. Tricuspid. And mitral valve. S1, S2 heard, no murmurs, no S3 or 4s. Now listen with the bell. Aortic, pulmonic, herbs, tricuspid, mitral. Again, S1, S2, no murmurs, no S3 or S4s. Moving on to the peripheral vascular system. Upper extremities, again, skin color is consistent with the rest of the body. There are some macules. Skin is warm and dry to touch. Now I'm going to check pulses. So brachial, bilateral, 2+, regular rate and rhythm. Radial, 2+, bilateral, regular rate and rhythm. Moving on to the lower extremities. There's hair present, which is good. He has a tattoo. Skin color is consistent with the rest of the body. No lesions. Skin is warm and dry. No edema. Toenails, pink. Capillary refill, less than 2 seconds. Now palpating pulses. Dorsalis pedis, 2+, bilateral, regular rate and rhythm. Posterior tibialis. 2+, bilateral, regular rate and rhythm. And then lastly, go ahead and sit up for me, sir. I'm going to check for any varicose veins. Put your dad first, get down. Be careful though. You good yet? Okay. So to check for varicose veins, I gotta look at the back of his legs. Turn this way. Switch it. Pull it up. No varicose veins seem to be present from what I can see. Thank you very much for your time. Hand hygiene. And we are now done.